Welcome to a special edition of Experts at EWU. This is part of an ongoing series where we bring in experts that are part of the faculty out at EWU. And what a treasury we have in our local university here, and so we're so pleased. This is a special edition to talk about COVID-19. Perhaps you've had it. Perhaps you've heard of it. Perhaps you know of people. And I'm pleased to have Dr. David Line, who is the director of the EWU Masters of Public Health, coming from Arizona right now. He's on location. And he's been called many times to help institutions and organizations and the public deal with catastrophes, pandemics, if you will, like we're dealing with now. So, Dr. Line, are you there?
I am.
Okay, well, welcome to the program. I wish we were talking under different circumstances, but you're in Arizona today. And what are you doing in Arizona? Who are you helping down there?
The counties and the state response, as well as some tribal responses.
Okay. So you get called on these pandemics. I got to get the word right. We're learning new words these days, words that are probably pretty common to you in your expertise and so forth. I've got several questions I'd like to ask you on behalf of our audience. And we've heard a lot about flattening the curve. The president, the governor, the local folks here in Spokane area and so forth talk about flattening the curve of infections associated with COVID-19 virus. Can you help our viewers understand the concept of the epi curve, how these curves are plotted, and why, honestly, are they so important to us?
So the epidemiological curve, or the epi curve, is the way we track diseases and how they spread. And so in a typical outbreak, we would plot on a graph with a x and a y axis, vertical or horizontal, if you will, the days of the week or the days of the month across the bottom. And we may designate the lower left corner as March 1st, and then have March 2nd progress to the right, and March 3rd, etc. And then on the vertical axis or the y-axis, we would plot how many people came down with that disease on this particular day.
Okay.
And so on any given day, we would have a point.
And so we're basically looking for that curve, which has been going up. Am I correct? Is that curve going up right now?
Yeah, so once we start plotting those curves, what happens is we can make a curve, and we classically have what comes out in the shape of a bell, so we call it a bell curve.
Okay.
And that bell curve is the distribution or the rates of people that are being infected. And a narrow, steep curve that's very tall means that the duration of the outbreak is going to be short, but the impact can be great. Whereas if we can flatten that curve and make it so that the bell is a little bit more broader, almost like a symbol, that's really, really what we'd like.
Right. So as it goes across, and then we want it to start going down, right?
We absolutely want it to go down. And what we really don't want is for the height of that curve to exceed the care that we can provide for that given disease. And so when we flatten that curve, what we're really trying to do is keep the height of the curve below the level of care that we can give at any given time. If we can make it like a symbol, so it's really flat, then what we've done is we've made it so that we can provide care to everyone.
And that's what we're hearing from various governors, especially I think of New York and so forth, that are worried about the peak in that curve that might exceed their ability to take care of people, right?
Absolutely.
Okay. We're also hearing the phrase contact tracing in association with efforts to limit the scope of the pandemic. how does contact tracing work, and why is it especially crucial in the early stages of an outbreak like this?
So contact tracing is when we're going to identify where the disease is coming from. And
Okay.
in some circumstances, such as very, very deadly diseases, such as the plague, we really want to know exactly who has it and isolate that person or quarantine them as quick as possible. And then we may be aggressive and isolate anybody they had a potential to come in contact with. And that's the way that we can address that type of an outbreak.
How would you address what happened early on here in Washington when we had a lot of contact or a lot of things going on with the pandemic and the deaths on the west side of the state, and specifically in an older population in rest homes where there's a lot of contact with people, and they probably didn't were not aware of this coming as fast as it did. So there's a lot of folks who maybe visited relatives there and so forth. They're in that kind of high classification to watch, right?
Yeah, so we have an incubation period, and that's the length of time between when you contract the disease and when you start to show symptoms.
Okay.
And during that incubation period, if you're infectious, that's a very dangerous thing. And so people that had the disease could go into a nursing home and not know that they had the disease. And since nobody is watching for the disease, then they can pass the coronavirus to people and well before they become symptomatic.
Okay, that was the question I was going to ask. So I've heard the case of 14 to 15 days and so forth. And so if I've gone into or been exposed to that, I'm able to pass that on to somebody immediately or pretty close to after being exposed.
Yeah, so you're going to have what we call a viral load, which just means that the virus is increasing its load or the quantity of virus within you. So we call it the viral load. That will
Okay.
take a couple of days to increase, and as that's increasing, you become more infectious. And
Okay.
then you could, and I've been looking for numbers on this, but typically we're thinking that it's going to be 2 or 3 days into when you've got the disease to when you become infectious.
Ah, okay.
And the average person is not going to become symptomatic until 5 days. And so, therefore, you have that 2 day delay. But what's even more challenging about this is that the delay of symptoms showing can be up to that 14-day window. And
Okay.
in that case, in some situations, you don't ever show symptoms. In those cases, the problem then is that you're infectious for a good 10, 11 days. And the next thing you know is everybody that you've had contact is potentially infected.
Now, when you say everybody that we've had contact with, who would be the people that I've talked to across a desk, met with? Of course, when none of us are shaking hands anymore, those kinds of things. But how close is it that 6 foot? Is it the 6 to 10 foot? Or is it really more than that?
It's actually a little bit more than that, but that's the working number that really matters.
Okay.
If you were to sneeze, then the moisture or the the sneeze would be out in the air for about 10 minutes.
Really?
And if you were to walk through that sneeze,
Okay.
then you've been exposed.
Okay.
But very few of us are in a situation, especially this time of year, where people are just sneezing. And so, therefore, the airborne particles are considerably less than that.
Okay.
And they've been doing some really good tests, and they found that really you've got to either just be sneezed on or have some kind of direct contact with the virus.
Okay. So people using, for instance, if I've been exposed to it and I'm contagious, but someone sitting down using my computer could be exposed to it by using the keyboard.
That's correct. And so the problem there is that the virus has a very long outside of the body life.
Really?
And so yeah. And what we're finding is some stunning numbers as far as how long it can live. It can live on hard plastics and steel for 3 days.
Wow.
And then if it's on cardboard, it's about 1 day.
Okay.
And if it's on fabrics, it can be as short as two hours. And things like temperature and humidity, as well as direct sunlight, will impact that.
Yeah. Is direct sunlight, does that help reduce the issue?
That is a very big part of reducing the issue.
Okay, so that's why I've heard people talk about get outside and get a little sunshine when you can. Stay away from people. Use the social distancing and so forth. But the sunshine is good for you because it's eliminating some of that.
Yeah, so let's say that I sneeze on my hand and I put my hand on a guardrail inside of a building.
Okay.
Then that virus could stay on that handrail for 3 days.
Wow. Okay.
Whereas if I'm outside on the Centennial Trail, for example,
Okay.
and I did the exact same thing, I sneezed and then I walked down to Boulder Beach and I put my hand on the handrail, that virus is not going to be viable for that long because it's in the direct sunlight.
Okay. Okay. Well, good to know. I've got a note here. Speaking of transmission, about an R naught calculation. What is that all about? Explain it in layman's terms, can you?
Yeah, so the R naught just sounds really cool, and so it makes me feel important. But I think the bigger thing is to just say that the R is the reproduction rate,
Ah.
or it's
Okay.
actually the reproduction number. And so the reproduction number is how many people I am likely to infect or any individual is likely to infect.
Okay.
And this particular virus, because it can live outside of the body for such a long time, it has a high R number.
Mm.
And so therefore it's we're finding that it's anywhere from 2 to 6. And the variables on that are temperature and humidity, as well as contact levels and things like that.
Yeah. You kind of answered this a little before, but I've got the question in front of me. Are you at all optimistic that the warmer weather in general will help bring that R naught down and slow the transmission?
I think so. And the reason I believe it will is because we're going to have greater social distancing, as we've already talked about, the biological aspects are there.
Right.
And so, as the temperatures increase, this disease does not seem to do as well as far as transmission. And so, the optimal transmission temperatures seem to be from about 30 to 50, maybe 60 degrees. And then, after 60 degrees Fahrenheit, it drops off considerably. And
Right.
so, places like Arizona and Florida have had lower transmission rates than places like New York and Washington. And that's good because as the temperatures increase for the summer, we
Right.
would anticipate that those transmission rates will decrease. In addition, as humidity levels change, will have a little bit of an impact. So the lower the humidity, the more it transmits. So places like Florida versus Arizona, which may have the same temperature, Florida should have a lower transmission rate from a biological perspective.
Ah. Okay.
That doesn't take into account the social aspect. So in
And we already
Arizona,
know what happened
there's
on
a
spring
lot.
break, right?
Yeah,
Yeah.
exactly. And so if we had a denser population, then the R number is going to stay about the same. If that population is staying inside because it's too hot outside, then all of a sudden we don't get that bonus.
Right. I've got a question that I kind of don't even understand, so I'm going to ask it in really layman's terms. But this all started in China. We know that.
Yep.
Did it start from a zoo perspective or animal perspective?
That's what we're hearing. So we're hearing that
Okay.
it's something that was transmitted from an animal into a human, and that's very common. It happens all the time. I looked up some numbers in preparation for this interview, and I saw that Texas had 1,000 infections from transmissions of diseases from animals to humans per year for the last 20 years.
Okay. Because of cattle
And
and everything else?
cattle, mosquitoes,
Okay.
rabies, pets, all sorts of things. And so the same thing is happening when we think about West Nile virus.
Right.
That's just a zoonotic transmission, and that accounts for about half of our zoonotics in Washington and Idaho. In Washington and Idaho have about 50 per year.
Okay. So, from here, any last statement that you want to give our audience that hopefully something optimistic as we look to warmer weather, as we look to flatten the curve and all of that?
Yeah, so just touching on a couple of things, when we touching on the zoonotics, I think it's important to recognize that we got cowpox, which was the way we came up with vaccinations to solve smallpox, and that was a
Okay.
zoonotic transmission. So what we found out was that cow maids that were milking cows had an immunity to smallpox, and that's what Jenner figured out. And so that's how we came up with that. So
Ah,
zoonotics is not necessarily a bad thing, and it happens frequently. And so we should be aware of that. And when I think about the flattening of the curve, we want to think about how we can do that in a social environment. And so we hear about President Trump concerned about, is the cure worse than the coronavirus? And we need to realize that poverty is the greatest social determinant of health. And so, therefore, having people not able to work may be worse than the actual coronavirus. And so, you have to look at how many people are getting sick versus what is the benefit of them working. And
right.
it's a tricky balance, and it's
It
very
is.
challenging for people to do, especially when we don't have some good numbers. Numbers that I would like to see, I would like to know how many people in the community have the coronavirus. When we see the numbers, these are people that have been tested, and these are people that self select to be in the population that we're testing. What I'd like to see is just how many people in Spokane or wherever have the virus. Once we know that number, then we will know how many people are spreading the disease and things like that. And then we can get a lot better decisions on
Right.
how to flatten the curve with the minimal impact on the economy.
Do you see that coming, that we'll get to know that in the next week or so, or is that a month away?
Once we have the test kits, we will start to be able to do that.
Okay.
And
Okay.
until as long as we have to reserve the test kits for a vulnerable population, then we can't do that additional study.
Okay.
My recommendation or my hope would be that once we have enough test kits and feel comfortable, that we would actually test medical people first,
Yes.
because that's going to do two things. That's going to help us understand how many of these medical people are transmitting, or even how many of these medical people had the virus and are now immune to it. And so therefore, they don't need to take the precautions that all the rest of us would need to take. That would be a tremendous asset to us. In addition, if I understand it's not a true sample, or a true uh, random sample, but if we have those people tested, we could just get a general idea of how many people in the community have it. So we get two benefits. A, we get more people that can provide care, and we also get a general idea of how many people in the community have this virus.
Great. Wow. I've learned a lot. And we hear a lot from the politicians and the others who are out there spreading the word, if you will, and so forth. But this was
Mhm.
good information. Thank you very much. Can we call on you again maybe in a week or 10 days and maybe get an update on what you know at that point? Would that be okay?
Yeah, absolutely. And the one
And if something
reason that
happens before then, let's hook up before that as well.
that sounds great.
Okay. Doctor, I appreciate it. It's good to know that we have the kind of caring expertise that we have in people like you out at Eastern. So thank you for all that you do. Stay safe, stay the distance, but I guess if you're going to ski and so forth, you can do that. And we hope to see you back in Spokane out at Cheney pretty soon.
As soon as possible.
Thank you very much. Thank you. You've been watching a special edition of uh, EWU Experts, and we appreciate your watching today. And have a safe day. Watch your social distances, okay? Thank you.